First, live, local. This is Fox 12 Now.
And hello, everyone. Welcome to Fox 12 Now. I'm Greg Nibbler. There is a live look of downtown Portland. That's a little bit different than what we started the show off with a couple of days ago. Obviously, it's looking a little bit gloomy, but that's just part of what's being here in the Northwest is all about. As this is Fox 12 Now. We start live streaming here every weekday, starting around 1 p.m. Pacific, going throughout the afternoon, covering a wide range of topics. You can find us on the Fox 12 Oregon YouTube channel. You can find us at kptv.com under the Fox 12 Now tab, or, of course, the Fox 12 Oregon app on whatever platform you are on. For this segment, we actually spoke to the Oregon Health Authority, Dr. Paul Cieslak, about the upcoming vaccines. So there is a new COVID-19 vaccine and a new flu vaccine, and we wanted to find out a little bit more about that and just get some information out there as far as what to expect, what to know. Also, for a lot of you who have kids who are heading back into school, is this important for you to understand, what's going on with that? We cover a lot of things during this interview, so let's go ahead and jump right into it. Here it is, Dr. Cieslak from the Oregon Health Authority. Thank you for being here with us on Fox 12 Now. Really appreciate your time. And obviously, we're talking about vaccines in particular with everybody heading back into school and everything that's happening there. But I think to just give everyone an understanding, can you let us know what vaccines are available right now when it comes to both COVID and flu vaccines?
Well, the COVID vaccines, the 2024-25 season formulation, are just hitting doctors' offices and pharmacies now. So I know that there is some available in Oregon. Probably the supply is still ramping up. I do expect that you'd be able to get influenza vaccine and pretty much any of the school required vaccines. COVID and flu are not required for school entry, but you should be able to get any of the school required vaccines pretty readily.
Looking at, just to focus on one of them, talking about the COVID vaccine, that's forthcoming. As you mentioned, it sounds like it's still rolling out here in Oregon, but I would imagine will be readily available here at some point. How important is it for everyone to get the vaccine to make sure that you have that protection against COVID? Is this something that's going to be required? Can you give us some of the details on that and just why it is that this is coming out and what that does?
Right. Well, as you know, there have been a series of mutations in the SARS-CoV-2 virus, the virus that causes COVID-19. Over the years, these mutations just keep coming. The strain that was in last year's formulation was the XBB 1.5 strain, and that was superseded at the early part of this year by the so-called JN1 strain. And we're still dealing with the close descendants of JN1, KP2 and KP3. They give them all these designations, but they're very closely related to the JN1 strain. So the FDA authorized and the CDC recommends that everyone 6 months of age and older get one of the 24-25 formulation vaccines, which is made with either a JN1 strain or a KP2 strain to more closely cover the circulating variants. We don't anticipate requiring this. We suspect that it's going to become an annual vaccination, and we don't require any annual vaccines for school entry. But it is recommended. And it's obviously more important, the higher risk you are. If you're elderly, certainly we would absolutely recommend it. If you have any other medical conditions that put you at high risk for landing in the hospital. But it's recommended for everyone 6 months of age and older.
And I'll just say personally, I feel like I know a lot of people who have been coming down with COVID as of late. Have you noticed, is there a spike going on in Oregon, or is maybe that just my perception of what I'm seeing?
There has been a lot of COVID-19 transmission. We kind of bottomed out at the end of April this year, but then through June, July, and August, May, June, July, and into August, the transmission kept increasing. And we see this based on what percentage of COVID tests that doctors are ordering are coming back positive. We went from a low of around 3% all the way up to about 18%. So that's a six-fold increase. And we saw increases in hospitalizations. It does seem to have leveled off a little bit, which makes me happy. But both the percent positivity and our wastewater surveillance data, which are really interesting, also show significant levels of ongoing transmission. There's a lot of virus out there. If you're going to be in a room with a lot of people, like a school classroom, you better figure that you're going to get exposed to COVID-19.
And getting those vaccines is going to certainly, I would imagine, help alleviate some of those issues.
That's right. At least early on, it will prevent infection by COVID-19. That sort of immunity tends to wear off after a few months, but you're still left with pretty significant protection against the severe disease, against getting hospitalized or needing supplemental oxygen or something like that. So we recommend it basically to keep people out of the hospital.
And going from the COVID side of things to the influenza, the annual vaccines that will come out with that, can you give us just kind of the rundown on, are those readily available right now? And when they do come out, how important is it for people to get that vaccine?
Right. Influenza vaccines are also recommended every year for everyone 6 months of age and older who doesn't have some medical contraindication to getting it, some medical reason why they can't get it. I get my flu shot every year for sure. People used to ask me, is this a bad flu season? I say every season's a bad flu season. Every season when flu is around, hospital beds start filling up. We see a lot more people in hospital with viral disease. And now we've got COVID-19 on top of that. Even before COVID, we would occasionally see in some areas of the state hospitals getting overwhelmed with flu patients during flu season. So it is recommended. I would note that COVID-19 seems to be somewhat worse. It's more likely to put you in the hospital, but both can do it, and that's why both vaccines are recommended.
How important is it just for the general population to get these flu vaccines, even if there's people out there who maybe like, well, I'm really healthy, flu never really affects me, I don't really need to go get this vaccine. Is there an importance for them to get that as far as protecting the general population?
Right. Well, if you're a healthy adolescent, for example, or a healthy young adult, you're pretty unlikely to be in the hospital with influenza or to have the virus kill you. It's much more serious and potentially lethal in the elderly, in immunocompromised people, pregnant women, or in kids under, say, the age of 5 who are seeing influenza for the first time. That said, flu is a pretty nasty disease and you're pretty miserable for several days. So I would argue that it's a good idea to get the vaccine just to minimize your likelihood of, being in bed with a splitting headache and malaise for 5 days. This is the kind of thing that with a common cold, many of us would still go to work, but with influenza, it tends to put you on your back for several days. And so just to avoid the misery, I would recommend it for everyone.
Yeah, I'm all for avoiding that misery. That gives me one other thing too, just this is kind of going from the school side, but I guess also for school or work, for anybody who is experiencing any kind of symptoms and maybe they're not sure if that's a regular cold or the flu, what are the things to watch out for and to be cognizant of, and then avoid going into work or school to prevent the spread of something like that? Are there any specific things people can look out for?
Right. Well, first of all, I would advise anybody with, when you're just starting to get cold symptoms or flu symptoms to stay home for at least a day or two until you see where the disease is going. You shouldn't be going to work if you have a fever, for example. You should be home for at least 24 hours after that. And then, see which direction the disease is heading before you're making your decision to go back. You're probably aware that with COVID-19, even in the best of circumstances, we recommend isolating yourself for 5 days and masking for another 5 days afterwards, because you can still be transmitting the virus to others. But other than that, it's common sense should prevail.
All right. Well, Doctor, anything else that you think is important for people to know just about the vaccines in general that are going to be coming out and will be available?
Well, again, both to keep yourself as healthy and hale as possible, and to prevent our hospitals from getting slammed with large numbers of patients that overwhelm their staff. We recommend both vaccines.
All right, Doctor, thank you very much for your time. Really appreciate it. I know you got a lot going on. It's very busy right now, and we appreciate your information here for us on Fox 12 Now.
Thanks for having me.
All right, I do want to say too, I also asked the doctor about any side effects because I know that's a question that a lot of people have. So I do have the answer here for that. And He said that, and this is his statement, as with most vaccines, sore arm and maybe mild fever or fatigue are the most common side effects. And then a couple of other things of note. After the flu vaccine, around 1 in a million will get Guillain-Barré syndrome, a transient but scary, partially paralyzing neurologic condition. So that is around 1 in a million, according to him. And then with COVID-19 vaccination, some people develop myocarditis, which is inflammation of the heart, which has also typically been short-lived. So a short-lived syndrome. He said the most common was in adolescent and young adult males ages 16 to 30, and usually after the second dose, given just a few weeks after the first dose in the original vaccination series. So that was those original vaccinations back when that came out. But wanted to make sure that was on there. That is something that that I did follow up with to find out about. But thank you for joining us. This is Fox 12 Now. And again, we cover a wide range of topics on here, things like this, where it's public information. And then coming up at 1:30 p.m., we're going to be talking about the Portland Latin American Film Festival. So that's something that's going on with Hollywood Theater, a really amazing theater here in town, in Portland anyway, if you haven't been there. And we're going to be discussing some of the films that are going to be there, what they have to offer. So a lot to cover with that. And that'll be at 1:30 p.m. on whatever platform you are on right now. It's probably where you can watch me live as well. So that's Fox 12 Oregon YouTube channel, kptv.com under the live tab or the Fox 12 Now tab, or of course on the Fox 12 Oregon app. And there are many, many things under those for you to check out and watch. Every day is different. Every day is a wide range of topics. So thanks for joining us for this, though. We're going to regroup. I'll talk to you here in about 15 minutes or so. I'm Greg Nibbler. This is Fox 12 Now.